So when it comes to psoriasis, you're probably thinking about creams, medications, that sort of thing. But what if some of the best tools for managing it weren't in your medicine cabinet at all, but in your daily routine? Today we're going to dig into that powerful connection between lifestyle and psoriasis. Okay, before we dive in, just a quick but super important heads up. This is all for informational purposes. When we're talking about your health, your doctor is always your number one source. So please, make sure you consult a professional for any medical advice. So let's ask the big question here. Beyond all the prescribed treatments, what's actually in your control? That's what we're tackling today. What can you actively do to manage your psoriasis? And that's really our goal here. Think of it like we're building a lifestyle toolkit together, a set of science-backed strategies that can work right alongside your current treatments, helping you take just a little more control. All right, let's get right into building that toolkit. First up, we're going to look at the areas where the scientific links are the clearest. We're talking diet, sun, and smoking. I want to start with a number that's, well, it's pretty hard to ignore: 75%. So, what kind of lifestyle change could possibly lead to such a huge improvement in symptoms? The answer? It's diet. Specifically, for people with psoriasis who also happen to be overweight or obese, that means a BMI over 25. A calorie-reduced diet showed some incredible potential. Studies found it could lead to a 75% or even greater improvement in symptoms compared to just standard treatment alone. But, and this is a huge but, we have to be really honest about the science here. The very same research that gives us that exciting number also points out there's, quote, high uncertainty in the documentation. So what does that mean? It means it's a really promising lead, for sure, but the evidence just isn't set in stone yet. Okay, so let's pop this into our toolkit. What are the big takeaways on diet? Well, first, if your BMI is over 25, managing your weight with a calorie-reduced diet is a key strategy to look into. And second, there's also some evidence that suggests omega-3 supplements might be helpful for improving symptoms too. Now let's move on to habits and your environment. Here, the science is actually pretty firm. Getting some natural sunlight and taking saltwater baths have both been shown to help. And on the flip side, smoking is a clear risk factor, not just for flare-ups, but for actually developing psoriasis in the first place. Okay, so we've covered some of the clearer links. Now let's wade into some murkier but really important waters. We're talking stress, alcohol, and exercise. And this is where it gets really interesting, because you see this gap between common experience and what the science can prove right now. I mean, so many people with psoriasis will tell you that stress and alcohol are huge triggers. But when you look at the research, the findings for both are pretty mixed, and the evidence is still considered weak. We definitely need to learn more here. So, what about exercise? Well, this is where the science makes a fascinating distinction. Intense physical activity seems to be protective. It's linked to a reduced risk of ever developing psoriasis to begin with. But for people who already have it, it's actually less clear if exercise helps improve the symptoms they already have. The jury is still out on that one. You know, all of this really points to one critical idea. Psoriasis is so much more than a skin condition. It's connected to your overall health in some really deep ways. See, at its heart, psoriasis is an inflammatory condition, and that inflammation, well, it doesn't always just stay on your skin. And that's why having psoriasis can, unfortunately, increase the risk of other serious health issues. The medical term for this is comorbidity. Yeah, you can think of it like a chain of risk. The inflammation from psoriasis can kind of create a domino effect inside the body, which then increases the risk for major conditions like cardiovascular disease and type 2 diabetes. It's a really powerful reminder that what happens on our skin is connected to everything else. And that's exactly why doctors recommend this holistic approach. Managing psoriasis effectively also means you have to keep an eye on the bigger picture, controlling those key health factors like cholesterol, blood pressure, whether you smoke, alcohol intake, and physical activity. So, we've gone through a lot of evidence. Let's pull it all together. What are the must-have items for our lifestyle toolkit? Let's get a summary of the most important takeaways. All right, here it is. Your toolkit based on the strongest evidence we've talked about. Manage your weight if your BMI is over 25. Think about omega-3 supplements. Get some sensible sun exposure. Don't smoke. And finally, be proactive about your overall cardiovascular health. Now, I know, looking at a list like that can feel like a lot, so we'll leave you with this question. Looking at this toolkit and thinking about your own life, what's just one small change you could explore first? Because, sometimes that tiny first step can be the most powerful one. Thanks for joining me.